Hi, and welcome back to another episode of the Healthy Aging Network. Today, we're going to be talking about health literacy, how to identify and prevent the spread of misinformation. So please stay tuned. Hi, and welcome back. Today, we're going to be talking about health literacy and how to identify and prevent the spread of misinformation. We're going to be talking today with Jennifer Lobb, who is a family consumer sciences educator for Ohio State University Extension in Franklin County. So Jenny, welcome back. We've had you a few times on our episodes. Can you just share a little bit of information about yourself? And then we can just start right with the topic for today.
Sure. Thanks for having me back, Kathy. So I am Jenny Lobb, and I work as a family and consumer sciences educator for OSU Extension in Franklin County. And I am a registered dietitian, and I have my master's in public health. So I like to do health education, talking about how to promote health and prevent disease, and just live well at all stages of life.
Thank you so much. And so, I know you want to talk about health literacy today. So let's just go in first of all and tell me a little bit about what health literacy is and some of the information that you have around that.
Health literacy is defined as a person's ability to find, understand, and use information to inform their health-related decisions and actions. And it's really so important because we get a lot of information each day from different sources. It could be people, including family or friends in our social network, people we work with, health professionals, like doctors, as well as from the internet or social media, things we hear or see on TV. And some of it is really good information, but unfortunately, not all of it is valid. Valid basically just means that a source offers correct, factual information that is based on research. And it's important that our information be valid because there is a lot of misinformation out there. And misinformation is false, inaccurate, or misleading information according to the best available evidence at the time. There is a subtype of misinformation called disinformation, and that is misinformation that's intentionally false and intended to mislead or deceive. But actually, many people who share misinformation aren't actually trying to inform.
So you said they aren't trying to inform. So why do you think that some people actually share that misinformation and they share it unknowingly?
That's a great question, Kathy. There's a few different reasons why people might share misinformation. One is that health information that is research-based that we hear again and again can sometimes get kind of old and boring. And if we hear something new, even if we don't know that it's whether it's valid, we like to feel that we have new information and we're eager to share that with others. When maybe, in fact, it would be better to wait and have that confirmed by research to see whether it is true and valid and beneficial. And another reason is actually that we want to protect people that we care about. And so when we see things online, for example, that we think could be helpful to someone, we're eager to pass that along, again, without stopping to check whether it's true or waiting. It's kind of the novelty of it combined with this wanting to help people. Unfortunately, it can actually hurt people if we're not careful and do that too quickly. Another reason people might share misinformation is that they're just seeking explanations, or they're wanting to make sense of what's happening in the world. This has been very common during the pandemic, where there's been a lot of uncertainty. A lot of misinformation has come out of that, just people wanting to try to make sense of things. It's hard to wait. It's hard to wait on the science and try to figure out what is best to do. And so we want these quick answers and solutions, and kind of hasten to do something when maybe waiting for the research would be better. And then finally, another reason we sometimes share misinformation is we just want to feel connected to others. And this is why some of this misinformation goes viral or circulates so easily and quickly online. We see something that maybe sounds good, maybe too good to be true, but it does sound good, and we share that, and we find ourselves in this echo chamber where we're sharing information with people who then confirm or share the information, even if it's not true, and it creates this sense of connection to other people.
Thank you for that. I was just, when you were talking, I was just thinking about how easy it is, like for something pop up on Facebook and, oh, so-and-so talked about this and they just got this diagnosis from the doctor and here's this magic pill that will fix it. So I'm going to click share, and this is really easy, right? And then that person shares it, and then it starts to snowball forward on and on and on. So I do love that the explanation that you have, that we're doing it to try to help people and stay connected with people. And I think it's something that in our helping nature that we don't realize how that misinformation might hurt someone, hurt our loved ones, like those supplements that I mentioned, or foregoing a treatment that a doctor has recommended because they saw something else online. And those can have some really serious consequences. So can you give us some tips or some information on how you can spot misinformation or information that's not accurate?
Yeah, there are some cues you can use. And actually the current US Surgeon General, Vivek Murthy, created a toolkit for addressing health misinformation, and we'll make sure to share the link to access that. And some of the common types of misinformation from that toolkit are websites that are designed to look professional, and may even have sensational headlines that catch your attention, like a new pill for this disease, for example. But the information on those websites is just not accurate. Another type of misinformation could be something that's just partially true, like a partial quote. Quotations where the beginning or the end may have been left off to change the meaning. And so it is something that a person did say, maybe even a credible person or a health professional, but without the full context, it's just not a full representation of what they said. Another could be similar to the quotations, cherry pick statistics. So choosing the range of numbers that people see, or leaving out a portion to make a point. It's just not the full data set, and it doesn't provide the full context. Similarly, sometimes misinformation could come in the form of a misleading graph or a diagram that's either been edited so that a portion is left off, or it just doesn't tell the whole story, even if it looks official. Another type could be old images that recirculate. Maybe even they've been redated so that people think they're recent, even when they're not. It could be a video that's been edited to change the meaning. Or it could be a meme, which is kind of like a comic, a fun, colorful image that was actually created as a joke. But sometimes people start to share those thinking that it was true, and it becomes misinformation, even though it was intended to be a joke. So as you can see, a lot of these common types of misinformation aren't completely false. Something that has a little bit of truth to it is more believable, and that's why people may share them, even though it's not entirely true.
I know, I remember when at the very beginning of the pandemic, I mean, I guess we were probably 6 months in, someone shared something on Facebook that had the header for the Texas State Health Department header on it. And the statistics just didn't make sense to me. And it was shared. And so I then, I began to realize that maybe someone could just copy and paste a header onto any type of graphic that they want to share. And so I know how I went about finding out if the information was correct, but what are your recommendations that we could go out and validate some information or just check the information that's being shared?
There are some things you can check if you're not sure if something is entirely true. You could start by looking for the author or the organization that either wrote or distributed that information. For example, if something has the CDC, the Centers for Disease Control logo, or a health department logo incorporated into an image, you could go to that organization's website and see if their website contains the same thing. If it doesn't, then it may be an indication that that image or that article was edited or altered to make it look professional, because it's not what the author or the credible organization is saying.
If we went to that site, how would we look up that information? Do we just search like a word, like a keyword in the header of that? Or how would someone go about if they're not used to navigating those sites?
Yeah, that's a great question. I think searching for a keyword would be a great idea. If it's a local health department, you could even give them a call if you have a question and have a good number. And sometimes if an organization knows that something is circulating with their logo or name on it, they might even have a warning right there on their page to let people know that they've been hacked, or that there's bad information out there that looks like it's coming from them, even though it's not. Thank you. Some other things you could check are the date that something was published. Especially in a pandemic world, the science is changing so often. Something that was published, what we may think was recent, could have changed. So, looking at the date that something was published is important. And if it's more than 5 years old, then it might be questionable. Sometimes, depending on the topic, even more. It may be outdated even if it was published more recently. You can always look at the evidence cited. So are there research studies cited to support what the article or video is stating, and also whether other credible sources are saying the same thing. And one indication that if you are looking at information online, you could use to see what someone's motive is for sharing the information that they're sharing is that URL ending, which is after the dot. So if it's .com, that typically means it's a commercial website that may be making money off the information they're sharing. That's not necessarily a bad thing, but it's something to keep in mind that there may be a little bit of bias there. Something that is .edu would be educational. So educational institutions tend to be good sources of information. That's a good one to look for. .gov is a government agency. It could be federal, state, or local, and those tend to be good sources of information as well. If you think about the Department of Health and Human Services, the CDC, your local health departments, those are all credible sources of information. .net stands for network, and that can be a tricky one because it could be any site. So that one you might want to, if you're finding information from a .net website, look to see if other sources are saying the same thing, just like you would do with .com or .org. .org stands for organization, and it may be a nonprofit organization. It's still worth comparing those websites with other sources and checking the citations to see if what they're sharing is most valid, most up to date, and trustworthy. You should consider information suspicious if it does seem too good to be true. In that case, you might want to see, if other sources are saying the same thing. If you can find something credible to back up that claim, or if it plays to your biases. We all have confirmation bias, which is when we look for information that confirms what we already believe. So for example, you might, if you're wanting to try a certain diet, you may be more likely to accept information that shares why that diet is good for you, and skim past any articles that would say why that diet is bad. Or if it's a supplement or a treatment, whatever it may be. So it's good to be aware of that confirmation bias and look for information on either side of the argument compared to what you found. If the information you find elicits extreme emotions, whether they be positive or negative, that might be a red flag. When information is edited or manufactured, it may be to elicit these emotions and get people to share. So that's always kind of a red flag to stop and just evaluate if it is good information. You also might want to stop and do a little bit of extra checking if it doesn't properly cite sources or if it appears to be out of date. You can also be on the lookout for disinformation tactics. So as I mentioned earlier, disinformation is a type of misinformation that is intentionally false and is intended to mislead or deceive. And it's dangerous because we process a lot of information each day, and we normally rely on mental cues to quickly make sense of what we're reading and what we're seeing. And those who are intentionally trying to mislead us use those mental cues to fool us. So they might, copy and edit a logo of an established organization like the CDC or like your health department and put it on their work. They might use visual cues like someone wearing a white coat or holding a stethoscope to make you think they're a health professional or a doctor, even when they may not have any credentials. They might just create a really nice looking website. When we're looking at things quickly, if something looks like it's professional and well put together, we're instantly going to trust that more so than we would something that looks a little bit cheaper or less professional. And then, of course, any reference, whether it be a personal post or story that references health professionals. So saying a family member works for this organization, for the hospital, for the government, to bring in that credible source, even though it's a secondary story can be a way to mislead or deceive. And then this point comes back to your question earlier, Kathy, about using search terms. So sometimes when people are trying to mislead, they'll use unique or rare terms so that when someone goes online to look for content, there are fewer links. So this bad piece of information will come up first in the source, and there won't be much else available for the fact checking. So if you come across something that you're really not sure about, maybe use some broader or more common search terms. Think of some synonyms you could use to fact check that information rather than typing in the title word for word to avoid going down that path. So those are some of those disinformation tactics that you might encounter. And the bottom line, whether a piece of information is intentionally designed to mislead or whether it just looks a little suspicious, the bottom line is that if you're not sure whether the information you have found is valid, don't share it. Stop, take a pause. Even if you think, wow, this seems like it's really new, it could be useful, before you pass that along to someone else, stop and take a moment to investigate it before you act upon it or share it with somebody else. And there is a really nice checklist, again, from that toolkit I mentioned that comes from our US Surgeon General. It's a toolkit you can use anytime you come across health-related content you're not sure about, to just kind of go through some questions before you act on or share information. So first of all, you can check with the CDC or a local public health department to see whether they have any information about the claim being made. You can ask a credible healthcare professional, such as your own personal doctor, or even a pharmacist, to see if they have any additional information. You can type the claim into a search engine, as you brought up, Kathy, to see if it's been verified by a credible source. Again, maybe not type it word for word, but try to use some more common terms so that you get a better picture of what's out there on that topic. And then look at the About Us page on the website that is publishing the information to learn a little bit more about them. And you might find that if something is manufactured, they may share less or they may share more vague details, whereas an established credible source would share their history and their mission, and you kind of get a sense of whether that source is trustworthy when you do a little bit of investigating about the organization.
Thank you. I think it's important, those About Us links on the website. Sometimes you have to scroll all the way to the bottom of that page to find the little button that you can push that says About Us. Sometimes that may be off to the side in like a small menu or across the top, but it is worth looking for as you search through these different websites to make sure that you know where your source is coming from. I do have a question for you related to some of the information that we have coming through from the CDC related to COVID and the changes that have taken place. Can you share a little bit about why we might be getting different messages as time goes on? Do you have any advice for that or any suggestions on why that advice might be changing for people? I just feel like people are getting a little bit frustrated and confused.
Yeah, absolutely. That's a great question. And it is frustrating. That's kind of just the nature of science. We have a hypothesis and we go out to test the hypothesis. And you can, sometimes what's true in one instance or scenario is true for a long while, and sometimes things change, and that's what's been happening a lot during this pandemic. As we learn more, too, sometimes things change. So, for example, early on, it was kind of on again, off again with, are masks helpful? Maybe they are helpful, but not necessary. And now it's pretty well established because as time has gone on, there's been more research done to demonstrate that masks are helpful and they're more commonplace. But early on, this was just, kind of a new environment we were living in, and there just wasn't good quality research at the time because we were doing the research, doing the science as we were living in it. So it just took a little bit of time to come up with that evidence. And it is frustrating to live in the middle of it while we're waiting for the research studies to be done to find out what makes the most sense. So I think what's important to listen for now is when healthcare professionals are getting much better at saying, this is what we know now. So for example, right now, we know that masking, vaccination, even testing are really great measures to help control the spread of disease. This is what we know now. We may not know a lot about the new variants that are coming out, but we're getting better at saying this is what we know now to kind of help people prepare for the idea that things could evolve over time.
Thank you for sharing that. Yeah, I know. I teach some food safety classes too, and we always have those updates from, for the food code and food safety because, our viruses and our bacteria, they're changing and morphing regardless, based on our environment. And so I think it's really important that we have that understanding that this is an ever evolving place we are in right now. And so, our scientists are trying to stay on top of it and trying to share the information as quickly as possible. And that may mean that our guidance changes from time to time. Jenny, I really appreciate you sharing this information with us today. We will put some of the links out available for folks to go and pull up some of those tools and some of the things to look out for. Do you have anything else that you want to share with us regarding the topic?
I would just reiterate that if you don't take away anything else from this topic today, the takeaway would be that if you're not sure, don't share. So take the time to do that investigating before you share or act on something you're not sure about. Because even if you're trying to be helpful, sharing bad information can cause harm. And we certainly don't want to do that for ourselves or our loved ones.
Thank you. Jenny, as always, you bring up the best topics and the best information to us, and I really appreciate you joining us today.